indeed produce more money to be spent on something else, parks or whatever. But what are the successful obesity outcomes that you know of having been affected by any of these, or that you know are under real study, efficacy study for our target, which I think our target is adiposity?
Well, the folks who are studying the soda taxes are in the process of evaluating impact on community, things like body weight. I would be very surprised if any one policy had an effect on obesity, and in some ways I think it's a trap to expect it to do that, because so many things are driving the problem, and so many things are affecting the food supply, levels of physical activity, and then, as Shariki said, structural things like poverty and education and access to health care, that to expect any one policy to turn that around, I think, is wishful thinking. But it's certainly important that it be studied as much as it can, so that at the end of the day, you know, as Steve has been modeling, where you get the biggest impact per dollar of policy change.
And there are really beautiful, like a double-blind randomized trial with young children, randomly assigned to continue receiving their sugary beverage or getting a non-calorically sweetened beverage, and you see changes in body weight over a 2-year period. Well, there's clear evidence for efficacy of these kind of changes, but as Kelly mentioned, you shouldn't be expecting any dramatic changes in the population. It'll take quite a while for these changes to really show up in terms of rates of obesity that are
particularly
detectable.
A regressive tax that will affect our underprivileged more than our privileged.
I'm happy to talk about
We have to be careful about that.
Comment on the tax?
Yeah, the regressive tax is very commonly raised, and it's, I think, a very valid issue. And one of the nice things about the data that are being collected on the taxes is just to look at their impact on various segments of the population, and to look who changes consumption the most, what other things they switch to if they're consuming less soda, and what it does to their overall income distribution patterns. And if the results show that the taxes have an adverse effect on the poorest people, let's say they continue to buy the same amount of soda and just have to pay more now, then you'd have to reevaluate the policy.
And I think there are people that are looking at whether adding subsidies for other kinds of beverages would help reduce that regressive tax. Similarly, looking at a graduated tax may have a different impact on consumption. So it's, there's some complexities to figuring out what the optimal way of structuring a tax if we're going to make it universal.
Frank Hu from Harvard T.H. Chan School of Public Health. There has been a lot of debate about whether food stamp or SNAP recipients should use the money to buy soda. As you know, the New York City tried to ban using the SNAP money to buy soda, but I think run into some problems. So I just want to the panelists comment on this potentially, I think, very effective strategy to reduce soda consumption.
Well, there's been a real battle between the public health obesity community and the hunger community on this issue. On one hand, the obesity community says, why in the world is the government buying $4 billion a year worth of soda, and then, of course, through Medicare and Medicaid, having to pay for some of the consequences of that. The hunger community is reluctant to decrease that benefit, feeling that it could be used as a weapon by the folks who are critical of the food entitlement programs to cut back the programs overall. Like, can't you just whack out $4 billion from the program benefit, which of course would be highly undesirable. And then also the hunger community says that people feel stigmatized already because of their poor circumstances, and having to use these benefits in the first place and having something removed would make them feel even more stigmatized. To me, these are empirical questions that need to be tested, and my hope is that the USDA would give permission, probably to some small locality, to do a randomized trial of having some people have business as usual and others have the benefit partitioning changed to see whether it has some undesirable consequences, what it does to overall use of the food dollar. Because again, people might continue to buy the same amount of soda, would just buy it with their personal money rather than their SNAP benefits, and then they have less money to pay for housing or heat or something, that would be undesirable, of course. So the only way to know is to do a test.
Deborah, did you want to
I
comment?
was just going to say, you know, the WIC program only allows the purchase of certain kinds of foods, and it might be interesting to compare what WIC recipients get to, you know, their diets compared to SNAP recipients to see, you know, what the differences are.
So, last question.
Sure. Rebecca Gee, Secretary of Health for the state of Louisiana. Our state motto is union, justice, confidence, but it might as well be eat, drink, and be merry. The eating and drinking is literally killing us, but the people of my state are fiercely loyal to their culture. And so my question is, what do you say to policymakers like me who are trying to change the state's culture in positive ways, but keep the good parts, and other communities that have not yet started, are not yet outraged by the obesity epidemic? We are the fattest state in this nation. And what would you suggest in terms of Medicaid policy change, if any? Are there any best practices you would suggest that we implement in our Medicaid program?
Do they have Medicaid expansion?
Yeah, well, I don't know. I can.
Right, you have Medicaid expansion, right?
We just did 320,000 people.
Hey, thank you. You did that. Hey, now it's your turn. Can we get another one?